We have an orthopedic surgical residency program, right? And I think that by the time uh, uh, residents get to their training program, the emphasis, understandably so, is on surgery. How many of this procedure did you do? How many of that procedure? Did you get proficient? Did you feel comfortable doing a knee replacement? How did that arthroscopic rotator cuff repair go? I'm going to choose my elective as residency based upon what I really, think that I need work in and things like that. And, it's the the lesson that I like to give them, or the uh, perspective I like to give them, is the fact that yes, we're training to be orthopedic surgeons, but you really need to have an important focus on the patients who are undergoing the procedure. All right, every patient has a story, right? Every knee replacement that you do, right, is not the same. I'm not talking about the technical aspects of it. I'm talking about the the issues that are confronting that patient, whether they need to go back to work, right? Whether they have a spouse at home that they have to care for, whether they've got a disabled child, right? Or what their financial situation is. And I think the more you learn about the patients, the more impactful the surgery that you do. I mean, we need to be trained to do, excellent surgery, technically proficient, all those things. But to me, it adds a whole different perspective when you really understand who you're performing that procedure in. And I think as residents in training, they tend not to focus on that initially because it's all about the reps. That's what they say. How many reps did you get? I need reps. I need this, right? And uh, I understand the reluctance to focus on the big picture, but my hope is that as they get through the process of training and into practice, that they recognize the importance of the patient and understanding the totality of the treatment they're providing and who they're providing it for, rather than just the technical aspects of it. I've had a lot of time to change my leadership style, right? Because it's hard to believe now looking back on it, but this is my 26th year as the department chair at NYU. And I've learned a lot through that process. Just as somebody, does an operation and, and then 50 procedures later, they're better at it and they do things differently. Well, the same thing is true when it comes to leadership and how you approach things. So I guess that, there are certain principles that I've learned that about my experience, and this is based upon, to a certain extent, trial and error. I mean, you think you're doing something right, and you realize that that's not the best way to do things, so you have to modify it. So to me, when you get to a position of leadership, one of the important things is that it's not a destination; it's a vehicle, right? Now you're sitting in to be the person in charge. You've got this opportunity to make everyone and everything better, right? And in doing so, you make yourself better. My predecessor, Viktor Frankl, was outstanding in that regard. He would give even junior faculty opportunities to do things to build their career, right? And because he knew the more successful they were, the more successful the department was, and as the department leader, the more successful he was. And that's an important thing, particularly if you take on a leadership position at a younger age. You're still building your own career. So striking that balance can be a challenge. I also learned that positions of leadership, it's more about responsibility than authority or power. Somebody says to me, well, now you've got all the power. No, I don't. I've got the responsibility. And the best thing I can do is develop consensus, right, amongst the individuals that you lead. Now, you can't always do that. Sometimes you're always going to make the executive decision, but the goal should be to minimize that, because if you make a decision, you need people to support you. And if you don't have that support, then whatever you're trying to do really won't be accomplished. I mean, there's a whole host of lessons I've learned. In fact, I have a talk that I give. It's called the 15 Commandments of Leadership. Things that I've learned. I tried to make it 10, but in deference to the Bible, but I couldn't get it down to 10. So, uh, I have a talk that I give on professionalism, all right? And we give it to our incoming residents, and it's kind of like a case conference, not X-rays, but I talk about cases that had an impact on me, even going back to medical school up until more current times, and because you learn something from each case. And I will tell you that as a relatively young surgeon, you want to operate. You've got the ability and the skills to help people. And I had a patient who was probably in his late 70s or so, married for many years to his wife here in New York City. And he had two terrible knees, right? Very arthritic knees, couldn't get around like he used to. And he and his wife, they enjoyed going to the theater, concerts. They would go up into the Massachusetts to a second home. They enjoyed all those things, but it was becoming increasingly difficult. And they came to see me, and it was clear he needed both knees replaced, right? And at that point, I decided, I recommended that. I decided to do both knees at the same time, simultaneously. So during the same operative setting. So we did one knee, we did the other knee. And back in those days, I was probably using a tourniquet for my knees, not for an excessive amount of time. And because I felt certain with 90% plus probability, this is going to change his life, right? And enhance his quality of life, just like we know we can do with the procedures that we perform. But and although about complications and you have to deal with complications, fortunately they're a very small percentage of the cases. But this is one where it wasn't, right? I dramatically changed his life, but not in good ways, right? Because one of the knees on that extremity developed a skin loss distally from some vascular changes that required extensive wound care. That led to an infection of that ipsilateral knee. And the story, infection. I had to take out all the implants, put a spacer in. I ultimately, and after a period of disability, obviously, I went back in and reinserted the implant. But by this time, this is now, 6 or 8 months later. He was in his late 70s to begin with. There's a general debilitation that takes place, and he just progressively went downhill. And ultimately, within a year or two, he died. Right? He didn't die of sepsis. He died of the associated comorbidities in somebody in their early 80s. And so, in an effort to make his life so much better, right, it dramatically changed it the opposite direction. So you always have to have. And I continued to see his wife as a patient for a number of years afterwards. And her life changed too. She couldn't do any of the things she wanted to. And it really, really had a negative impact on her, as you would expect. So the lesson there is we do great things for patients, all right, but they don't always work out well, right? And you really have to think carefully about it. So if I had to do this all over again, I never would have done, both knees during the same operative setting. I probably would have had more comprehensive preoperative vascular consultation and such, right? Because look at the outcome. The outcome is not anywhere near what we hoped it would be. So this provides me with a very healthy respect for what we do and the impact of what we do. Well, that's changed through the years, all right? When I was younger and we had two kids at home, right? We would be continually, going to different athletic events or other events, and so weekends would be very busy, all right? Now they're not busy because I have a son who's 36 and a neurosurgeon, and another son who's 33 who's an architect. So it's just my wife and I, which is just fine. So for me, I have very busy weeks. All right, Monday through Friday are very busy. When I get home Friday, I'm very happy to do nothing. All right, and just we have a routine. My wife and I like routines. So Friday night we'll go out to dinner. Right, Saturday we'll go through our usual routine in the morning. Go out, get coffee, get breakfast. Right, run some errands during the day. Have something social that night. I mean, before the advent of COVID, we would love to go to the theater in New York City, but we haven't been able to do that because of the obvious reasons, right? And then Sunday we try and do the same thing, right? Go out to dinner again, but have routines and just kind of sit around and relax. Do certain things, but make it a calm, right? Take it easy weekend. Now we're fortunate we have a house in upstate New York as a vacation home, so I would say, uh, 2 weekends a month we go up there, and people say, well, what do you do up there? I say, nothing, because it's nice and it's calm, all right, and it's outdoors and we can enjoy ourselves. So that's what I've come to. It's kind of boring, but we like boring. Well, I'm not sure it's a book, movie, or a holiday, all right? And what affected my life the most was having kids, all right? To me, that was the most powerful thing, even more so than getting married, all right? Because your kids, you've had some role in producing. I remember, dramatically for me, my wife was on bed rest for 6 months with each kid, all right, because of potential for premature uh, uh, labor and things like that. So with our first son, she uh, finally is allowed to get up out of bed. Nothing, nothing happened, but then they had to induce her for one reason or another, and she delivered like 3:30 in the morning on a Saturday. Right, this is when we were living in New York City, and after things got settled, I went back to our apartment, showered, changed, made rounds in the hospital, and then I was driving my way back up to the hospital uptown, and I remember thinking that here it is, this baby is, you know, 8 hours old, maybe not even, and if I went up there and they told me that something uh, had happened and the baby needed a kidney transplant, a bone marrow, or something like that, some maneuver, without hesitation, all right, I would give it to him, right? Because that's how powerful it is to have a child, right? When they're an infant, then, and you extrapolate that, and our children have had the most important impact on our lives. We build our much of what we do around them. Not only we both professionals, my wife and I. She's a psychologist, psychoanalyst, and we both have careers, obviously. But the whole thing works, and the whole thing is worthwhile. The big picture is because of the children we have. So that's what it's been for us.